Hi everyone, my name is Hunter Keller. This is my reflection for my practice patient encounter, the second one. And it was kind of an open-ended question, so I'm just going to kind of go over some advantages of telemedicine and the disadvantages. So to begin, some advantages are increased access to care, the convenience of it. It's really cost-effective because you're not having to take a lot of time between nurses and doctors coming into clinic rooms. You're not having patients drive to a clinic just to see a doctor, or usually the patient will see a CNA, then a nurse, then a doctor, and that doctor might not even help them. So this is kind of just a quicker way to do it. As well as this improves patient engagement. Patients can access their health information and communicate with their providers more easily, and it just leads to better involvement in their care. And it's timely, so a lot of these telemedicine, you can do it whenever. People can be on call. You don't have to be in a waiting room because they receive immediate consultations for like urgent issues and stuff like that. And the continuity of the care is a lot easier because these patients they don't live in Bismarck and their doctor's in Bismarck. They don't have to drive as far. They can just do it online. And there's a broader range of services with telemedicine because you can do mental health therapy, there could be specialists, and it kind of encompasses a variety of healthcare services. And telemedicine is also an efficient use of resources. Healthcare providers can see more patients in a shorter amount of time, which optimizes the providers' schedules and their time, so they have more time to see other patients in person, or they don't have to work as many late hours. And this is very accessible for the vulnerable populations. Say there's paraplegics or people that can't walk, older people, just mobility issues. It's a lot easier for them to come see the doctor through a camera screen versus getting them out, because usually they'd have to probably contact a transit service to come get them and then take them to the clinic and then take them back, and that kind of can become expensive. So, and then some disadvantages of telemedicine. Obviously, the main one is that there's limited physical examination because you're not hands-on with the patient. And there's technology barriers because some people don't know how to run technology, and that's very common in today's world. Some people might have privacy concerns because they're online. They might be talking about really private things about their healthcare, and they're just worried that their information is going to be spread because it's online. There could be technical issues. People don't have Wi-Fi. People don't have good connection. People don't know how to run their computers. And there's reduced personal interaction. The lack of face-to-face interaction affects the patient-provider relationship. Complex cases can become really, really hard to handle over telemedicine, I guess. Like, if you're trying to get blood work done, it's kind of hard to do that over telemedicine. You're going to have to come to the clinic, and you're going to want to know this stuff face-to-face. And the potential for misdiagnosis is a lot higher without physical examinations because there's a higher risk of inappropriate treatment and recommendations. And one thing I found interesting is that there's actually a limited insurance coverage on telemedicine. Not all insurance plans cover the telemedicine services, which can create financial barriers for some of the patients. And one really big thing that I think is a disadvantage of telemedicine is that it relies purely on technology. It's not HIPAA compliant if you're texting or just calling over the phone. So it has to be through a telemedicine website. Okay, so there's a little bit of my disadvantages. And then I kind of just want to play my video and then go over it a little bit, if that's okay. Let's see here. See if I can get it up. I got an ad, so just have to wait a little bit. It's almost over here. There we go. Skip it. Oh, wrong video. Give me 2 seconds here. There we go. I got it right here. Alright, so you can see me starting here. I'm asking for consent of my patient here to video him. And then I go on here. We start doing some health history questions. Then I had him take his heart rate here for 30 seconds, and I multiplied that by 2. Then we went over some stretches on what he can do to feel better. So I had him do some sit down on his heels. And I had him, next I think I had him do some cat-cows, which is right here. Really get that lower back extension and flexion going. Deal with some of that soreness. And then I had him touch his toes. Then we went to shoulder, upper body movements. Then I kind of concluded. I let him know. I told him that I was going to refer him to the athletic trainers on campus at UMary, just because he is an athlete at the University of Mary, and it would help him. It's going to benefit him. It's never going to be a disadvantage for him. So, and then the second question is, if I could do this again, what would you have changed about your preparation or patient care? I think mainly one really big thing is obviously just being prepared fully. It's really hard in a mock patient interview because you're telling your patient exactly what's going to happen, whereas in the real world, that's never going to happen. Usually they're going to fill out a health history form. You're going to get it on your computer before you see them in person, and you'll kind of have a basic idea of what they're coming in for and what you need to look for, not just, okay, here's this patient, you know who they are, and that's it. And it's really hard to do anything with no background information on your patient. Like, it's almost impossible. I've shadowed a couple of doctors, and it's sometimes when patients come in and they have no idea what's wrong with them, it usually takes 2 to 3 clinic visits before they even have a general idea of their diagnosis if it's complex. But if it's simple, it still can be hard, because say someone comes in with a headache, it could be 100 different things, and the doctor just kind of has to guess or go through all these procedures and list these symptoms of other things, and the patient has to respond with yes, no, I don't know. And we can kind of narrow that down as a physician to just understand what we're looking for. And I didn't think the patient care was too hard, like how I approached it, because obviously I just did stretching and just body movements. If it was more like specialized care, I think it would be really difficult with not having an education. But overall, I think everything went well. Wasn't too hard. It was a new experience, so I'm glad I learned how to do it, and it's something that I definitely would be interested in doing again in my healthcare career.